Hello, my name is Jasmine Adami. I'm a fourth semester nursing student. Today is September 29th, 2018. It's about 1 in the afternoon, well, like 1:30. And I'm going to be performing, inserting an NG, giving meds via the NG, and then removing the NG. So to start, I've assessed my patient. I've gathered all of my supplies. I would make sure that they are able to have this procedure done. I'm going to look in their nares to see any surgeries they'd had. You want to make note of that if they'd had any nasal surgeries, and then look through to see which nair I want to use. Looks like the right one's going to be a little more open for me, so I'm going to use that one on the mannequin today. So I'd make sure I've checked my doctor's orders, and since we're giving medications, I've already checked the meds and prepared those before coming into the room, and they can be crushed, so I've crushed those and added it to 20 milliliters of normal saline, and then I've got my flushes and everything ready to go for that. So I'd come into the room, introduce myself, check my two patient identifiers. I am going to explain to the patient what is going to be done. I've already given them their water, so we've kind of talked about how the procedure is going to go and when they're going to drink their water when we're inserting the tube. I've provided privacy, and like I said, doctor's orders and everything are taken care of. So to start, I'm going to measure. And so to measure, you go from the tip of the nose, tip of the earlobe, down to the xiphoid process. And then I've got my tape ready here. So what I'm going to do is put a piece of tape here from where I've measured so I know how far to insert this tube. Okay, so now that I've done that, I'm going to perform hand hygiene and put on non-sterile gloves. My patient's in high Fowler's for the procedure, and I've already placed a towel over their chest. So that's ready to go. Alright, so now I'm going to grab my tube. Here I'm going to lubricate about 4 inches before inserting. Alright, so first I'm going to have my patient hyperextend their neck. I'm going to go along the side of the nair, insert this all the way till I hit the oropharynx, and then I'm going to have them put their chin to their chest, so pull all the way forward, and then this is when I'm going to rotate 180 degrees, and then they are going to start swallowing. As they swallow each sip, I'm going to insert 2 to 4 inches. So here we go. And then this mannequin only lets you go so far with this into the stomach. So for in real life, I would go all the way to that tape. So I'm going to temporarily place this tube on my patient. I am going to, this tape doesn't stick too well to the material, but I would tape it temporarily. Look in the mouth, just make sure it didn't coil and come out that way, because it can do that. But the patient, it doesn't look like it's in there, and the patient tolerated well, so it seems like it's in the stomach, so we're going to chest replacement. So to do that, you can either take your piston of air and insert the 10 milliliters of air into the tube and listen over the stomach for a swooshing sound, or you can use the pH strips and get a little bit of the residual and test it on the strips. Of course, the definitive test is going to be a chest x-ray. So now that I've done that, I'm going to, placement's good, I'm going to permanently secure this tube to the patient. So now make sure it's all cleaned and washed on there so that you're going to get a good stick with that piece to hold it. I've got another piece of tape here that's stuck to the table, so I'm not going to peel that off. But I would take that other piece of tape, like the one that I did for placement, and then use a safety pin and secure it to their gown, making sure that they have room to move their head side to side. So now that the placement is good, I'm going to document how the patient tolerated, and now that you could hook it up to suction, but since we're giving meds, we're going to go right into that. Like I said, I've already got my orders and checked that. Meds can be crushed, so I've already got that set up in the room. Check your patient identifiers again. Do all your med checks before you come in. This thing is really in there. Okay, so we're going to start. All right, you're going to start with placement's good. We've already checked that, so I'm starting with 20 to 30 milliliters of normal saline. With this guy, we've got to give a lot of gravity to pull this in here. Good. So once that flushes, I can give my med. All right. Good. Flush again. 20 to 30. Make sure it all goes through. Next med. So just making sure you're flushing between each of those meds, however many you're going to be giving. we're gonna give 2 today. And then, so since that's my last one, we'll do my last flush. Okay, now that that's flushed all the way through, that is my med administration. I would assess how the patient tolerated, document all of that, and document the meds I gave, all that good stuff. Okay, so now it's been a couple days. I am going to come in and I will removing the tube. So removing the tube, I've again assessed my patient, like I would have gloves on, so. But assess the patient for bowel sounds and make sure they haven't had any nausea or vomiting, because if so, we probably wouldn't want to take it out. Leave that in when you have that. So they haven't had any nausea or vomiting. And if they were to have a tube feeding, make sure that's been stopped 30 minutes before you're removing it. So I've already instructed to my patient, checked my 2 patient identifiers, I've got my order. So we're good to go. They've got their privacy. So I've got my patient sat up. I'm going to unhook all this tape from them. I've got a towel placed here in case stuff gets a little messy and I can help take it out to discard it. Or unhook it from their gown. And then so they know that they're going to take a deep breath. As they take a deep breath, here we go, 1, 2, 3. I'm going to take this tube out into the towel, discard everything. As I'm doing that, assessing my patient, how they're doing. They did okay. I'm going to document all of that and good to go.